Hello, this is Jason from Liberate Raleigh. This is another Liberate Raleigh video. In this video I'm going to be looking at the topics of continuing with the book The Voluntary City. I'm going to be looking at the chapters covering mutual aid, healthcare, and education. So these are public services that are typically considered the purview of the government as far as who should be providing these things. However, as shown in the Voluntary City chapters relating to these things, private provision of them did exist before the government got involved with them. So the first one I'm going to look at is mutual aid, which is how people went about providing things like social welfare support. So if people fell on hard times or they needed welfare to get by, there were organizations in place that took care of this for people. So this was the main way of providing these services until the 20th century, when the government got very involved in these things in the United States. So what they would, the organizations that would do these, provide these services were various fraternal organizations, fraternal associations. And what these typically consisted of was a system of lodges. They usually had a ritual involved, and they had internal democratic governance, and they would provide mutual aid for the members of these fraternal societies. And there were two types of fraternal societies that were prevalent in the United States, and these were secret and insurance. Now, the main difference between them was the secret societies would emphasize more of the ritual aspect of membership, and insurance fraternal societies would emphasize more of the insurance, more of the social safety net benefits. But both did provide these mutual aid benefits to their members. And as I said, this is what was going on in the United States, and they grew in the 19th century, but they did grow out of European organizations that did the same thing. And the European organizations that would cover these services, the main ones were confraternities and guilds. And I'll get a little bit more into both of those as far as the history in Europe in just a second here. So that's going to be that's where we're going to start. We're going to look at the European organizations that these American ones grew out of. So the first set of European organizations that I'm going to talk about are confraternities. Now, confraternities were organizations that did not discriminate based on the occupation of their members. They would pretty much accept anybody across any spectrum. They were typically named for some sort of religious icon, and they tended to be, as far as their internal government, democratic and egalitarian. Now, they also provided various welfare services, like payments for sickness. If somebody became sick, they might underwrite dowries for women. They also endowed hospitals and engaged in some other social safety nets that were required for the lower classes. Another thing about these confraternities is that they engaged in precursors to actuarial analysis, because they assessed their members based on age and the risk associated with them, because they were paying out for health. They might pay out for things like sickness, so they would start to assess their members based on age and their risk to those sorts of things. And the other thing was, another aspect of them, like I said, they were named for a religious icon. They had a very strong religious aspect to them. So you could almost say that their primary purpose was to promote some religion or religious beliefs or something like that. I believe some of them would spend a lot of money on religious candles, but they were also one of the main ways that these social safety nets were provided to the masses in Europe. Now, one of the other organizations that I mentioned earlier in Europe, the guilds, however, were restricted to a single occupation. So you had to have a certain job or engage in some sort of business activity in order to be a member of a given guild. And they also provided many of the same services that confraternities did, like payments for sickness and things like that, and they helped to found hospitals. They also did things like subsidizing joint stock companies, and they would also found towns and cities at some points in time. However, there was another aspect to them that was not voluntary, in that they exerted political power on behalf of their members. So, I mean, that's kind of easy to see, where if you have a large group of people that engage in the single occupation, there might be certain government regulations and benefits that would benefit those particular people in that single occupation. And the guilds would act in their interest politically. So there was also that aspect to the guild structure. Now, this is taking place in the Middle Ages of Europe, and these particular associations were very prominent earlier in the Middle Ages, but as time went on, they did tend to decline over time. But other organizations would step up, and I'm going to cover those here in a second. So, for a time, these two organizations were some of the biggest voluntary associations that would handle these sorts of social safety net services for the public. So as the confraternities and guilds during the Middle Ages began to decline, some other organizations stepped up. These were the Freemasons, which focused on ritual, loosely associated lodges, and fraternal societies. So the Freemasons would focus on merchants, the merchant class. So those were the people that would sign up with them. Fraternal societies did not discriminate. They would focus mainly on wage earners and artisans. So more of a lower class was involved with them. And the fraternal societies grew during the 18th century. Through the 19th century, the fraternal societies boomed because they were, due to the necessity for burial insurance. Now the Freemasons, they also grew. They grew in Europe, and then they expanded into the United States in the 18th century. And so the lodging system would expanded over into the United States, and there were various lodges and Freemason organizations that grew into the United States, and then they tended to go on their own divergent path from the European Freemasons. So once, as I said, when the confraternities and the guilds declined, Freemasonry and fraternal societies became more popular, and each servicing a different segment of the population. They expanded, and Freemasonry expanded into the United States, and fraternal societies also became a model that was used throughout Europe. And both of them provided various services to their members that the confraternities and the guilds were previously providing. One other important aspect of the fraternal societies was that they did not discriminate based on the categories of age or risk with their members, and their services were funded by premium payments from their members. So again, this is going back to the you think of the title mutual aid. This was the mechanism by which the fraternal societies engaged in mutual aid, pooling of resources through membership premium payments into a pool that would be used to provide these services, and that's how those services were provided after the decline of the confraternities and the guilds. Now, in the early 19th century, there was a group called the Odd Fellows, and they were an organization that provided sickness and burial services to their members. And their main thing was, well, their little innovation and contribution was they had a clearly defined schedule of benefits for their members, which were provided based on the premium payments that their members were engaging in. And they referred to those benefits as benefits and rights. So it wasn't like this was welfare that was a payment from one person to another. They would call them rights to their members because they were providing a defined set of payments and benefits to their members based on what was being paid in. So that was one way to that was how these payments became more formalized, as earlier these organizations engaged in a more haphazard manner of paying these things out when they provided these services. Another thing about the Odd Fellows is, as they grew in the early 19th century, their footprint that they serviced became much more geographically wide. And what this allowed was for members to retain their benefits if they were to relocate or move to different areas. They didn't lose their benefits or have to find a different organization to join. They were able to retain those benefits as they moved about geographically, which helped people to reduce the cost. I mean, if you think about this, that reduces the cost of moving, and it gave people a wider degree of freedom. So these were a couple of the big innovations and benefits that the Odd Fellows were able to provide to their members in the early 19th century as they grew. Another class of organizations that grew in the United States in the 19th century were national life insurance orders. And what these would do is they would allow the lower classes to insure against abject poverty. And like if somebody died or something like that, they were able to have a certain level of livelihood. And these became very popular in the 19th century. There were a bunch of numerous orders that were around in the United States, and they provided these services to their members, and they were described using the term any quote-unquote enormous army at the time. So it was an enormous army of the lower classes that had come together to get these services from these national life insurance orders throughout the 19th century. And they became very popular in the 19th century to provide this social safety net. Now in the 20th century, these organizations, all of them, began to decline for a number of various reasons. Social tastes changed a little bit. There was also, however, government regulation, and obviously probably the main one that ultimately was the death knell for these sorts of things, as any sort of meaningful method to provide the social safety net, government crowding out. So the government, again, these things are being provided and handled by voluntary associations, but the government has the incentive to expand its purview and to extend it, increase its power over other aspects of people's lives. So they began providing these services, and that tended to crowd out the organizations. It removes the incentive of people to actually sign up for them or provide them, since the government is already providing them. So they did not step in and fill a role that was needed. It was the government, again, as in pretty much all the things the government does, crowded out something that was already there and took it over for themselves. But these organizations were very effective at doing what they set out to do. And that was provide a social safety net for the masses of the population against catastrophes or other life trials and tribulations that might deleteriously affect people's livelihood. So moving further along in the Voluntary City, the next chapter talks about how healthcare was provided, and a lot of this chapter talks about goes over the history of the group, one of the groups I mentioned earlier, fraternal societies. So they formed the basis of healthcare. So a lot of this particular chapter covers material relating to their history before relating these organizations to healthcare at the end of the chapter. So this history covers a lot of the United Kingdom and Australian friendly societies that grew dramatically in the 19th century and the early 20th century to provide social welfare services. By the end of that time period in the United Kingdom, there were, maybe it was just England. England, I'm sorry. In England, there were 10 million people, 10 million members of fraternal societies at least. And in Australia, there was another several million members of friendly societies, fraternal societies in Australia. And these organizations would eventually expand into the United States. So they started over there, grew dramatically, and then expanded into the US. So during this time period, these friendly societies, I'm sorry, I've sort of been using friendly and fraternal societies interchangeably a little bit, but these are the friendly societies I'm referring to. They allowed families to stay self-supporting when the primary monetary breadwinner would suffer some sort of accident, illness, or death that would affect their ability to bring in a livelihood. And so the friendly societies would provide for death and sickness pay, support for widows and orphans, and various other forms of payment, and also might set up a branch doctor that would provide medical services for the members of the friendly society. Now, these friendly societies would also, the ones that grew such that they had multiple branches and had a wide geographic net, here again, as mentioned earlier, they would provide services for traveling members who would move from one place to another who might be looking for work. So they could retain the benefits of the friendly society while they were moving if the particular society in question was large enough. and had a wide enough geographical range and multiple branches. So that was another benefit of the expansion and growth of these friendly societies. Another important aspect of these friendly societies was their promotion of various moral values that they would try to instill in their members. So, for example, the hard work and self-reliance, for example, were very important things that friendly societies would help promote amongst their members. And when someone would join for the first time, their initiation, or part of their initiation, was a period of was to view this joining the friendly society as an opportunity to engage in some self-criticism, to find ways to improve their life and be a better person. And that was again, another aspect. And they would also do things like promote tolerance for others, equality amongst people, and so on and so forth. Now, this didn't just end after you became a member and you went through the initiation rituals. Many friendly societies would have things like degrees that members could work towards, that would again promote these particular values amongst their members. So you could, as you worked and gained these degrees, that was a way of signifying that you had inculcated and taken on these particular moral values that the friendly societies were trying to instill. Another one that was a very important thing was the idea of democratic governance, such that everyone had an equal say in how these organizations were run. So it didn't matter whether you were rich or poor, an influential member. The idea was that you had a say in how these organizations would be run. And another thing I touched on this earlier, another thing to keep in mind is this wasn't really welfare in the sense that it was a transfer payment, or it was not resources being moved from one group of people to another group of people. This was the pooling of resources voluntarily between a group of people. So it was a collectivization of resources for the purpose of providing various social safety net services, and this was distinguished friendly societies from regular charity. And because of this, the services that were provided by them were considered rights as opposed to just a payment or charity. So, and you think about it, that's kind of another reason why they might be very big on promoting these various these particular values of self-reliance and hard work, because this was an active community that was coming together to handle a particular challenge that would be facing all of their members. So they wanted people to improve themselves as a method to help deal with these things. So these were some of the aspects and properties of the friendly societies as they grew in the 19th and early 20th century. So there were some other interesting things going on with the friendly societies as they grew, as far as their internal ordering and management. As they grew, and there might be more branches associated with them, they would transition to a more tiered structure. So there might be some local autonomy for a given branch. Maybe there would be districts that would handle multiple branches, and then either a semi-annual or annual review board that might meet to handle overall long-term management of the friendly society as a whole. And one of the critical aspects involved with this was the idea of democracy, like as not a democratic state, but democracy as a voluntarily agreed upon organization structure. And the main thing that this led to was the idea that people in this tiered governance structure were intended to be subject to the members at large. So it wasn't that they were above the people at large and above the mass of the members, and could set down edicts that there was no recourse for handling. It wasn't that they were the ones with power over the general membership. It was vice versa. The general membership would have these people in place in order to implement the rules that they desired. And so that was a very important thing, that the office holders were subject to these rules, and they were not like, for example, like a monarch that was involved in ruling over this group of people. It was actually vice versa. So this just goes to show the benefits of voluntary organizations, wherein people are able to create the structures that they desire and implement whatever rules they see fit for whatever their subjective preferences are. Another benefit of this was that there were a lot of manual workers in society at that time, and because of their lifestyle, they were manual workers, so they worked with their hands all the time. They might not have actual access to certain skills that would be prevalent for somebody in a less manually oriented job. So one of the benefits of these friendly societies was that manual workers might have the opportunity to serve as office holders in them, and this would allow them to develop non-manual skill sets that they may not have previously been able to have access to. So this was, again, another way that these friendly societies were able to help people develop themselves personally and professionally. They were able to allow these manual workers to gain skills that, again, they simply wouldn't have had access to. Going further along with the previous idea of voluntarily agreed to democratic governance structure, and the idea that these office holders were subject to various rules, this of course led to the codification, or the writing down of rules. And further along with that, this led to the creation of rule books that would define the scope and authority of the office holders and what they could and could not do. And again, this was subject to the to the desires of the memberships, the members at large. They were the ones that would come up with these rule books and develop them, and then these rules codified in the rule book became the basis of holding the office holders that managed and governed the friendly societies, holding them accountable for living up to their obligations. So when these structures are voluntarily agreed to and organized and managed, the focus becomes creating these structures that will satisfy the preferences and desires of the people that are being serviced by the organizations. And that, again, that's a very positive aspect. As far as joining these friendly societies, there were typically membership stipulations that were restrictions on who could join. Sometimes they were moral restrictions or age and health restrictions, but generally these particular stipulations were not strictly enforced. The moral character ones, for example, the main reason behind them were so that the friendly societies would have the opportunity to exclude, say, criminals from joining their ranks. And again, the age and health limits, while sometimes enforced, they were also subject to exceptions. And another stipulation of joining was bringing up, again, the rule books that were agreed upon by the people, that were created and written by the people that were members. The stipulation was that if you were joining, you had to agree to the existing rule book and be bound and subject to those particular rules. But again, as people were free to join or not join, there was no gun being put to their head forcing them to join. This goes back to, again, the entire system was a voluntary one. So people were voluntarily creating these rules that they were subject to. And as a stipulation, in order to join the friendly societies, you had to voluntarily agree to be bound by these rules, and these rules were out in front and you could see them, so you knew what you were getting into and you were free to decline. There was no violence or force involved with people joining. This was again a entirely private and voluntary endeavor, and that's, in my opinion, that's always how you get the you get the best solutions and services. That's the best way to go about doing it. So now that a lot of this information and backstory relating to friendly societies has been established, we can now look a little bit at how medical care was provided during this time period. And this is in Britain during the 19th century. So there were three main ways that healthcare was provided at this time period. The first was through charities that would just provide these services to the less fortunate. Second was a direct payment by a private party to a doctor or hospital directly. And the third was through contract or club practices. So the main one that provided a lot of these medical services was the contract and club schemes, and the primary provider of those particular plans were friendly societies. So contract, I'll just call this contract plans, contract healthcare. This was when a person would pay a flat fee, and this would entitle them to various health services over a given period of time. So let's say we'll look at a year, say maybe a year membership premium or payment. So you would pay a given amount of money into the service, and over the course of a year you were entitled to various types of medical practices and medical services. And the friendly societies were the ones that would one of the largest providers of these services to their members. So if you were a member of a friendly society, you would be paying your premium into the friendly society, and the friendly society would be paying some of that out for contract health care with either a doctor or doctors or various other medical institutions that would provide these services to the members of that friendly society. Now, as the friendly societies grew and their medical services were they expanded further into medical services. They ran up against the organized professional medical lobbying organizations or professional organizations. And the reason why this happened was because as the friendly societies would expand their role in healthcare, this would create the incentive for more, because there was more demand for healthcare. This would create further demand for doctors, and more doctors would enter the industry, and that created more competition for existing doctors, and that would reduce their wages. The other thing was the friendly societies were generally able to pay higher premium payments. So doctors that were willing to work for these contract plans were the ones that were getting the higher wages, and so that would draw the best doctors out of general practice into contract practice. So the organizations, the professional medical organizations, tended to not like this, and they wished to have a wage cap placed on them. So it's kind of, it seems a little bit between a rock and a hard place here. They didn't like the reduction in wages beyond a certain point, but they also didn't like that doctors were being bid out of the general health practitioner business into these contract plans, which the friendly societies were engaging in and expanding in. However, over time, various health organizations and friendly societies, just through the natural course of doing business and interacting, would come up with ways to negotiate these things out. In the book, again, I have to reiterate, when I cover these things from the book, there are tons and tons of material and information that I simply can't. I'd be sitting here for hours and hours and hours going over it all. So a lot of things that I mentioned, and this is one of them, how these things were negotiated out in particular instances and in certain cases, is covered in the book. So again, don't just watch my videos. I highly recommend this book. But again, these things were negotiated between the friendly societies and the various doctor organizations and professional organizations. So by the end of the 19th century, many of these friendly societies were expanding to the point where they were creating their own medical institutes that were staffed by salaried doctors that would provide services to their members. And some of them would even own the premises that all of this was done on, like the surgery dispensaries and sometimes even doctor living quarters were owned by the friendly society and run by them. And again, this was because of the governance structure. These were managed according to the preferences of the actual members. And a current analogy that would sort of be like a similar type of organization to these would be the staffed health maintenance organizations that are currently in practice in certain areas. So again, these friendly societies, prior to their decline through various reasons, mostly government regulation and crowding out, prior to that decline, they were expanding and building medical facilities that were available to their members and providing that service in a voluntary manner outside of the coercive actions of the government. So again, these things were provided privately prior to when the government stepped in to quote-unquote solve the problem of these things. So yeah, that's healthcare. Just add that to the list of things that were being taken care of through private voluntary action before the government stepped in. So further along in the Voluntary City, another chapter covers education and its private provision through voluntary means outside of the state. And this chapter looks at three different scenarios, three different time periods and geographic regions. I'm only going to cover two of them. These are England and Wales in the 19th century, the United States in the 19th century, and the book was written in, I believe, or was published in 2002, and they cover material, they have material covering Indian education and Indian schools. So I want to cover England and Wales in the 19th century, in the United States in the 19th century. And if you want to read about India in the 1990s and early 2000s, then I would highly recommend you get the book. But I'm gonna do a high-level overview of those two that I mentioned and leave the India information in the book. And not cover it. I prefer to look at these things, look at like the past as far as how things were handled prior to government involvement. So not that what's being done currently isn't interesting and worthwhile. I prefer to look at, particularly, things that happened like a century or two ago, or multiple centuries ago, before the advent of current technology, and also before the governments became extremely large and obtrusive. So anyway, just wanted to preface that I'm only covering a couple of the areas in the that were covered in this chapter. So the thing looking at England and Wales in the 19th century, one of the main things to remember is prior to 1870, when the Forster Act was passed, there was very little involvement by the government in the provision of education services. Now, one of the things that needs to be pointed out is at the time of this passing in 1870, literacy rates had risen to 90+%, and there was some controversy over the statistics that were used as far as showing that literacy was a problem, but the authors go into an examination of what studies were used and some of the shortcomings, and I don't want to get into the weeds there. I just want to go over the high-level stuff. So again, I can't cover every little detail, but I really recommend that you get the book so that you can read about this. The main takeaway is that literacy rates were extremely high at the time that the government stepped in to provide education. So the other thing to take into account is even as early as around 1813, John Stuart Mill was commenting on the lower classes and their love of learning. So even as early as 57 years before the government passed a law to step into the area of education, people were taking that onto themselves to engage in learning and seek out education services. And this was exemplified at the time by the expansion of enrollment. So early in the century, I believe from 1818 to 1834, enrollment had risen from around 500,000 students to over 1.2 million. And then by around 1851, it had nearly doubled again to over 2 million. And so you can see that the effectiveness was pretty high because the literacy rates had reached a very high level. And also the expansion of the number of people receiving schooling was growing dramatically throughout the century. And the other thing to take into account is around 1851, when some research was being done to look into this, what was going on. Over 2 million students were in primarily private schools. So about 85% of the schools that these students were enrolled in were private schools. So they were not government schools, and they did not receive government funding. They were privately managed. And another important thing to take into account with respect to the other 15% that were categorized as public schools is that it wasn't that they were run by the government. It had to do with some of the funding that they received. So if they received any government funding at all whatsoever, they would fall into the category, and they would fall into that 15% public school category. Now, the other important thing to note about that 15% is that most of the funding was actually private funding. Even though these schools received public funds, they also received private funds, and in totality, most of the funding was actually private. I believe the ratio was 2/3 private on average to 1/3 public. So you can see that throughout the 19th century, there was a huge expansion of education services as far as number of schools and also just general enrollment, going from 500,000 to well over 2 million over the span of several decades. So education was a very big priority for people in England and Wales in the 19th century, and that led to the expansion of private schools. So yeah, private voluntary action was engaging and stepping up to provide these services that people needed. Another important aspect to keep in mind when looking at the expansion of enrollment and also the increase in literacy during the 19th century is to remember that at this point in time, the government generally was hostile towards particularly the lower classes of people becoming literate, and the general literacy rate rising. And I'll touch on that in just a second here. The form that these things would take is the government would pass restrictions and regulation of printing. So that would tend to decrease the amount of literature available to people, and people would be less likely to gain the ability to read. So they tended, and the other thing was they would appoint state and church authorities to determine whether certain things that were being printed were proper or heretical or seditious in a sense. So yeah, they tended to, the government just had a general tendency at this time period, during this time period, to show some hostility towards the growth of literacy, particularly among the lower classes. So they weren't exactly going out of their way to get people to learn how to read because of this. Now, gradually throughout the 19th century, these things were relaxed by the government, but it's important to keep in mind that these restrictions throughout the time period that I said earlier, where the enrollment was expanding and literacy was rising, and during this time period, at least either all or at least part of these restrictions that would prevent the growth of literacy were in place by the government. So they were kind of growing, literacy and education was growing despite the government sort of trying to fight it in certain ways. So as I just mentioned also, there was the appointment of state and church authorities to determine things that were seditious or heretical. And so to give you an example of something that that was considered seditious or heretical or just controversial, and was something that government didn't really like people reading because they might read this particular thing. And that particular thing, as an example, was Thomas Paine's The Rights of Man. So it doesn't really take too much thought to figure out why the government might not be too fond of Thomas Paine. Thomas Mann was the guy who wrote Death in Venice. I always get those two. I sometimes get Thomas Mann and Thomas Paine mixed up. So Thomas Paine's Rights of Man was a sort of seditious material that the government was trying to prevent people being aware of. So yeah, again, it doesn't really take too much thought to figure out why they might be trying to put the kibosh on that one. So yeah, but the main point is, throughout the 19th century, despite the government engaging in actions to prevent the spread of literacy and the growth of literacy and enrollment in school actually rose. So during this time period, again, there were private schools and also public schools. And another thing to keep in mind is that when compared, the private schools would tend to outperform the public schools, such that they were more effective at increasing the rate of literacy. So the private solutions were doing a better job of providing education, and the criticisms of private schools at the time tended to mostly concentrate on criticisms of moral and religious things. So they weren't really criticizing the effectiveness of being able to increase literacy. They were criticizing the particular moral or religious things that they might be teaching, or the fact that they were not teaching the desired moral or religious values that the government bureaucrats would prefer. But again, this goes back to the dichotomy and oftentimes the conflict between the desires of government authority as expressed through the bureaucrats that may be running it, and the people themselves who are actually the customers or clients of any given service, in this case schools that were providing education. So the people that actually wanted the education and were paying for the service from the schools were getting what they wanted. It was the government bureaucrats who had their own ideas of morality and religion that were complaining over what the schools were teaching, even though the schools were teaching what people wanted. And this is a very common tension, and it doesn't just manifest itself in education. And again, this goes back to frequently this would go back to the aforementioned seditious materials, such as Thomas Paine's Rights of Man, that sort of thing. So that's an important thing to keep in mind when considering the criticism of private schools from that time period. They were mostly just objecting to things like the ability to read Thomas Paine's Rights of Man, or those sorts of seditious things, seditious ideas being available to the general public, or various other moral or religious values. But again, this is just simply the government bureaucrats' subjective preferences. not any indictment on the school's ability to provide education to its actual customers, which was the general public. So taking a look at education in the United States at this time in the 19th century, prior to about the middle of the 19th century, education was provided almost exclusively through private for-profit schools. So the schoolmasters, this due to demand for these services, curriculums would expand due to competition between various schoolmasters. So yeah, these schoolmasters would, because in order to compete, to gain customers, and again, like I said, they were for profit, they would have to expand what they would cover and what they were willing to teach. And this happened throughout the first half, approximately, of the 19th century. Now, many schools were run by churches and religious organizations and other charities, and sometimes, so there was very little involvement. There was very little government involvement in this during this time period. So you had these private schools, and you also had churches, religious organizations, and charities that were running schools. And there was a tremendous expansion of the curriculums and lessons that were being taught due to public demand. And the government involvement at the time period, such as it was, tended to be reimbursement for tuition to various private schools. So that's sort of similar to what might be what people would call a voucher system in the United States currently. That would be the closest analogy. So the government at the time, this reimbursement wasn't actually running the school, although through various other, this isn't a case of exclusively no government influence due to public choice analysis, but in the vast majority of cases, these were privately run organizations and run for profit or through churches, religious organizations, and other charities. So the small involvement of the government was to reimburse tuition. However, tuition at this time in the United States tended to be low, and it was very accessible to the general public. So continuing to look at education in the United States during the 19th century, one of the things to keep in mind is by around 1850, literacy rates had risen very high to at least 75%, and most likely it was higher because in the 1850 US Census, only 10% of people actually identified as illiterate. So through the first half of the 19th century, there was a tremendous expansion of education, and there was a tremendous increase in the number of people that were enrolled in schools and education. So another important thing to keep in mind is, prior to 1850, this was almost exclusively a private endeavor, providing education to people. It wasn't until after 1850 that the government began to step in and provide public education. So from the time period of 1850 to about 1920, so a good 7 decades, there was no, and the other thing was government made school attendance compulsory. So people didn't even have the option, supposedly, to whether they wanted to attend school or not. And prior to that, it had been voluntary. But the interesting thing is, for those 7 decades, attendance rates dropped 2.6%. They were even to down. So it wasn't that people weren't going to school, and then through compulsory education, people started going to school in greater numbers at a greater rate. The numbers did increase, but that was mainly due to the black population being able to go to school after the Civil War. So that was less just, compulsion doing its work of getting people into school. It was the number increase was due to just an dramatic increase in the number of people that were actually eligible to start going to school. So the important thing to take away here is that literacy rates and attendance rates didn't actually rise after the government started to get involved in providing public schools. That wasn't the case at all. So why did the public schools actually start to come into being? Why did they begin to exist? Well, one of the main reasons was there were people that wanted to supposedly preserve the white Anglo-Saxon Protestant culture that was prevalent in society at that time. And the reason for this was there were a lot of Roman Catholic immigrants, particularly from Ireland, but also from countries like Germany, who were coming to the United States. And again, they were Roman Catholics instead of they were predominantly Roman Catholics as opposed to the predominantly Protestant culture that existed in the country. So as a means to protect the Protestant culture and values against the, I'm going to put it in quotes, quote-unquote, onslaught of Roman Catholic immigrants, public schooling was promoted and expanded. But the important thing to remember, one of the numerous important things to remember is when you look at what actually happened, you had a private system in place that was meeting the needs of the population, and it was successful, but the government stepped in and took it over. That's the mechanics of what actually happened. Was there was already a system in place that was working, but because of these other subjective preferences relating to enforcement of cultural norms, the government stepped in and replaced that private system with a public school system that took it over for the purpose of instilling these particular social values. And it did not result in an increase in the amount of in the rate of enrollment or literacy. So it wasn't actually doing the job any better. It was just sort of taking over what was already there and then tacking on these other, forcing people to making it through force of law, making people go to school. And it was for the purpose of forcing these particular social values on unwilling people, because there was a large influx of immigrants that were not that had certain cultural aspects to them that people, certain people in the country did not like, and had different preferences. So they wished to preserve their own preferences through the use of government force. So that brings the look at education to an end, and what brings to an end what I want to cover in this particular video. And again, I reiterate this all the time. This book, The Voluntary City, has tons of information. I simply cannot cover all the details involved. I can only give a very high-level outline of what's in them. So I highly recommend, even though I think I do a pretty good job of hitting the high points and hitting the important things, I still highly recommend that you buy this book and read it. And I will continue to recommend in every video that you buy this book and read it, despite the fact that you may be watching my videos. So anyway, that's the end of this one. This video covering the Voluntary City's explanation of private voluntary provision of the social welfare and social safety net, healthcare services, and education prior to the government stepping in. So a lot of good information there. I hope you guys enjoyed this. Hope you learned something. I know I did when I was reading these chapters, as I've done through every chapter in this book. Hope you guys have a great day, and I will see you in the next Liberate Raleigh video. Thanks a lot. Bye.